Hello everyone, welcome to yet another episode of Fridays with Dhawale. Today's episode is on stress management, a step to better health. Let us start with the definition of stress and understand what stress is exactly. Stress is a kind of response, maybe physical, emotional, behavioral, to perceived stressful, dangerous situations. Perceived stress means a degree of stress experienced by us. How do we feel about stress? How do we think about stress? Is our perception to stress. Same situation or event for some may be stressful and for others may not be stressful. A person may perceive stress as dangerous, and the response of stress may be flight from the situation. So it depends on the perception, how we think and feel about stress. So that means a perceived stress. Stressors, on the other hand, any person, situation, place, thought, situation causing emotional and physical tension is called as stressor. Number of situation can lead to stress. Simply, causes of stress are known as stressors. Types of stress, there are commonly two types of stress: acute stress and chronic stress. Acute stress or short term stress is a stress that is not bad for us. Not all the stress is bad. Little short term stress is beneficial at times. That is called as eustress or good stress. This stress helps us with motivation, focus, energy, and performance. For example, stress of a deadline in your job, stress of exams, that helps us with our performance is acute stress. On the other hand, chronic stress is a long term stress, high levels of stress for extended long period of time that has negative impact on our overall health is distress or bad stress. What are the sources of stress or stressors? So we have divided it into three places: at workplace, family place, and social place. Sources of stress or causes of stress at workplace are commonly workload, unfair treatment, interpersonal conflicts with colleagues, lack of acknowledgement, lack of rewards, etc. At family place, financial stress, illness of family members, illness of our own health, traumatic events like death, separation from loved ones, etc. are the common causes of stress at family place. At social place, addictions, loss of job, retirement, death and separation of friends, socio-economic discrimination are common causes of stress at social place. Physiological effects of stress on body. Whenever there is emotional stress or psychological stress, our body reacts in the form of stress response, that is alteration in our homeostasis. Alteration in homeostasis leads to activation of CNS, that is central nervous system, and endocrine or hormonal system. That leads to activation of our hypothalamo-pituitary axis, and that in turn increases heart activity, decreases the reproductive system function, and decreases the digestive function. These all systems, when affected for a long period of time, causes physical effects on our body, which are as follows: increased heart rate and blood pressure, stomach upset, nausea, diarrhea, increased or decreased appetite, weight loss, weight gain, sweating, chills, tremors or twitching, frequent headache, frequent sores or aches in body, menstrual cycle irregularities, frequent allergic cold, flu, infection, or hair loss. These are the physical symptoms caused by stress, prolonged stress. Effects of stress at different levels, like at intellectual plane. Patient may show signs of forgetfulness, disorientation, slowness in thinking, comprehending, and difficult concentration. When there is a prolonged stress, people show commonly decreased difficulty in concentration. At the behavioral level, patients may show blaming behavior, criticizing behavior, impatience, changing in eating patterns, addictions, and frequent arguments. At emotional plane, जल्दी से गुस्सा हो जाना, irritability, moodiness, anxiety, restlessness, aloofness, hopelessness, etc. may be commonly seen. At social plane, withdrawal, that is अकेले रहना, isolating from people, difficulty in listening and sharing ideas, at social plane we commonly see when patient is in stress. Now, understanding stress cycle, whenever there is a stressor, our body reacts to the stress and there is wear and tear of the body in the form of physical symptoms that we saw just. Then there is reduced optimal health, there is increased sensitivity to again a new stressor. But the good news is that you can control this. How? By changing your perception to stressful event into a learning experience or even into a new challenge. By managing stress in effectively by some stress management techniques, which are as follows. First is positive affirmations for de-stressing. Positive affirmations means staying positive in difficult situation. Like instead of saying I can't do this, say I'll do the best I can. I have got this. Instead of saying I feel helpless and alone, you can say that I can reach out and get help if I need it. Instead of saying I can't believe I screwed up, you can say I am a human and we all make mistakes. I can fix it. So positive attitude during stressful situation helps us manage stress effectively. Time management is a crucial part in stress management. It involves planning and organizing events in a scheduled and systematic way. You can manage your time according to the SMART criteria, where S stands for scheduling your plan, M stands for measurable, clear, specific goal settings for a day or week, A stands for plan management, plan achievable, and R stands for realistic goals for a day, T stands for time specific. So managing time according to this SMART criteria helps us do work in a less hard manner, less stressful manner, and in stress-free environment. Healthy nutrition. It's a myth that drugs relieve stress. During stress, people may commonly get indulge in drugs and alcohol, but it's a strong myth that drugs relieve stress. Instead, eating a balanced and healthy diet manages the physiological changes caused by stress. Physical exercise has a direct stress busting benefit. It stimulates the release of hormones called endorphins. These endorphin hormone helps us enhance the mood and health in general. So yoga, physical exercises, these are common exercises that helps us manage stress. Social support in stress management. Social support means support of your friends and families, neighbors. You can share your ideas, stress with them, communicating with them. It helps improving the ability to cope with stressful situation. It helps by elevating the effects of emotional distress. It promotes lifelong and good mental health. But how does a homeopath manages a case? Let's see with a case example. This is an example of a 25 years female complaining of polymenorrhea. 7 days of 15-day cycle. Cycles are painless. Itchy eruptions in groins worse at the beginning of menses. With this, she also complained of severe left-sided headache 2 to 3 times monthly, which was worse with sun exposure, light exposure, noise, and better by heart pressure. Her investigation was suggestive of USG report showed right ovary 33 by 25 by 30 mm, left ovary 30 by 30 by 24 mm, bulky ovaries with multiple tiny follicles. TSH value was within normal limits. History. She works as a quality control officer in pharmaceutical company and studies MSc in chemistry in correspondence. At family place, she has financial stress, like she belongs to a middle class family, so she feels that she has responsibility of home household chores. She has conflict with siblings, especially elder sister, which never does household works, and she is the one that she does all the household chores. So she believes that family members takes her elder sister's side and not her side. Also, there are conflicts with relatives like uncles and aunts. They criticize for the lifestyle of patient and her siblings, so she feels sad. There is conflicts between the parents, constant fight, so she feels alone though living in a joint family. She feels aloof. At workplace, there are issues with boss and colleagues, stress of workload, lack of acknowledgement and rewards. She feels a stressful environment at workplace because her friends and colleagues, she feels that they do backbitching, so she doesn't like to spend time with them. At social place, she has a pleasing behavior. She tries to please her friends. There are constant arguments, feeling of compromise during conflicts. She feels that I am the one who compromises every time whenever there are arguments and conflicts. So again she feels stressed with friends also. In this case, we have seen stress at all the three levels: at family place, at workplace, and at social place. Effects of stress in this case are: her appetite is reduced, she eats small quantity 2 times a day, stool is frequent loose watery stools from increased nervousness at workplace and family place, menses are irregular, profuse, early menses with eruptions during menses, sleep is disturbed from frightful dreams of murder, quarrels, ghosts, and fights. Management in homeopathy, there are three types of management included, like remedial management, ancillary treatment, and diet and lifestyle modification. Remedial management: constitutional remedy based on totality of symptoms was given. Totality of symptoms covered in this case are: elements from discord between parents, elements from discord between chief and subordinates, mind forsaken feeling, sensitive to criticism, sensitive to external impressions, responsibility taking too seriously, mind delusion neglected she is, dreams murder, dreams quarrels, dreams ghost, skin eruption menses before, head pain side left, head pain exposure to sun when. So a homeopath gives constitutional remedy based on the totality of symptoms. After inquiring the detailed history of patient, physician tries to come on a similar remedy, which is given on the basis of totality of symptoms as follows. So the remedy that came was Magmure. Magmure has all these symptoms. It has strong forsaken feeling, strong repressed desires, which is commonly seen in the form of dreams. In this patient, dreams are very characteristics, like dreams of murder, quarrels, and ghost. Ancillary treatment: ancillary measures are the healing aids which helps us to treat our cases. So in this case, counseling and psychotherapy was advised. Diet and lifestyle modification was also advised. So in this case, the patient showed good improvement with the remedy and ancillary measures. Her itching eruptions also reduced during menses, and her menstrual irregularities were also reduced. Now her menses are regular. So in this stress management PPT, we saw about stress in general, causes of stress, sources of stress, and management of stress. Thank you.